Right. So, good afternoon and welcome again. We are live with another informative session today, and a very special topic, by the way, a very common issue which I think we may all have suffered in our life at any point of time, but we never thought to get a solution, or maybe many are suffering on daily basis, and it's just they are dependent on certain kind of laxative. That's it. So we are talking about the constipation, and I think one of the best person to like deliver a session and to train all of us is Dr. Kohli with us, Dr. VM Kohli. Thank you, sir, again for taking time from your busy schedule and like guiding us in these sessions. These sessions are really making an impact. We got the feedback from some doctors that every time they are waiting for your session now eagerly. So thank you so much for this, and this will definitely take us to a new approach that how we can integrate both aspects, the allopathic modern science and the Ayurveda, and take it forward in a positive note. Ultimately, patients are getting healed and benefited. And special thanks again to the entire team of Dabur, Dr. Durga Prasad, and we have Anuj with us from Dabur today. And thank you again, Anuj, and the entire team of Dabur for ensuring these type of sessions on our platform. And recently, as we have been now listed around 30 plus cities on Google first page. So it's one of the first Ayurveda site which is being listed. And recently, we have also completed the 773 districts of India. So we are now the first Ayurveda site being listed on all the districts of India as well. So we will definitely ensure that these sessions will reach to each and every doctor, Ayurveda doctor, allopathic doctor, and other people as well who are healthcare professionals and who can understand and who can help the people who are suffering. So I know I will not take much time without wasting much time. I will hand over the session to Anuj. And we are very much looking forward for this session today because constipation is a very common problem. And let's understand the holistic management of that issue from Dr. VM Kohli in today's session. So thank you again, sir. And Anuj, over to you for the another aspect of this session. Thank you.
Many thanks, Dr. Piyush. From the entire family of Dabur, we welcome you to this special webinar from an expert in the field of medicine, Dr. Kohli, Dr. VM Kohli. We are again thankful to Dr. Kohli for sparing his valuable time and throwing light on such an important session, on important topic rather, right? And constipation, as Dr. Kohli says, many suffers from physical constipation and many suffers also from mental constipation. So we'll dwell more onto that as to how physical and mental constipation are very challenging to treat, right? We are also thankful to the entire team of indianvedyas.com for streaming the session live, and congratulations to Dr. Piyush and the entire team for spreading your wings to 30 plus cities across the country, right? So with this, let me give a small introduction of Dr. Kohli. Although he is very famous now, he doesn't need a detailed introduction. Dr. Kohli, as we all know, is a specialist in adult cardiac surgery with experience of over 8,000 cardiac operations within India and overseas at the University Hospital Uppsala in Sweden. He was instrumental in setting up cardiac surgery department and initiating cardiac surgery in various top-notch hospitals within India, such as Escorts Heart Institute, New Delhi, the Batra Hospital, New Delhi, Hero DMC Heart Institute in Ludhiana, Sri Balaji Action Medical Institute, New Delhi, and Arjuna Heart Institute, Nagpur. Dr. Kohli practices and promotes holistic medicine and is passionate about integrating Ayurveda, naturopathy, and other complementary systems into the mainstream medicine. He has received multiple honors, including Distinguished Person Award from the Old Martinians Association in 1999, having excelled in the field of cardiac surgery, Certificate of Merit from the Apollo Hospital, Chennai in 1985, for contribution towards successful completion of first 1,000 open heart surgeries, and Certificate of Appreciation from the Old Martinians Association, Australia in 1999. And with this small introduction, Dr. Kohli, may I hand over the session to you? And please go ahead and throw some light on this. We'll be joining by Dr. DP in some time, and then we'll open the session for the Q&A session from the doctors who are listening to us. Over to you, Dr. Kohli, for this session.
Thank you. Thank you, Dr. Piyush and Dr. Anuj, for your kind words. And well, I'm nobody to teach anybody. I'm also learning. but yes, we can share our thoughts, and we can share whatever we know, and we're always learning from each other. So I'll just go ahead. May I have the first slide, please? Now, as has already been mentioned, constipation is such a common problem that, as Piyush ji has already said, there probably isn't anybody who not suffered from it at some point of time. And the very first thing to remember is to understand that our digestion, the gut, has a lot to play for any has a big role to play for any disease in the body. This, of course, has been voiced by Hippocrates, and Ayurveda strongly believes in this because practically everything is focused on that. Now, we should understand what constipation is because this has various definitions, and Western medicine speaks of it in a different manner. Now, it is believed, as per Western medicine, that if one doesn't move the bowels for about 2 to 3 times a week, then they label it as constipation, or if the stools are very hard, or one has to strain for a long time to evacuate. Now, all of these come in the domain of constipation, but very often patients don't understand what it actually it is. So therefore, we need to understand as well. Ayurveda, of course, calls it as Riband, that is symptoms where there is less bowel movement associated with pain, bloating, abdominal discomfort, and of course, incomplete elimination. Now, the basic point to understand is, which of course is again, borrowing from Ayurveda, that constipation is a Vata problem, and Vata means dryness. So that, in a very subtle way, makes it very clear what the cause can be. We'll discuss this later. Next slide, please. Next one, please. Yeah. Now, what I want to stress here is that constipation, though by definition, is incomplete evacuation and things like that, which I've already just mentioned. But constipation is just a symptom. It is not a disease, and we need to understand why it occurs. Because if it is not addressed properly, it leads to very serious complications sometimes. So we need to understand that first. Next one, please. So, if it is not addressed properly, there are a host of problems which can occur because of constipation. One is very common, like piles, fissures, fistulas. Then fecal impaction can occur. Fecal impaction is something which I've seen firsthand, and very often patients who are bedridden, they have vague abdominal problems, and when you go into the detailed history, you understand that if they have not been able to evacuate for a long time. And no amount of enemas, no amount of laxatives help in such cases. You need a manual evacuation to actually relieve them of their constipation. And this is something which I've done myself. Many doctors in our field have had to do that. So this is a fairly common problem. We must not forget it. And because of constipation, one can have intestinal obstruction. It can be a sigmoid volvulus. It can be an acute intestinal obstruction. One can develop diverticular disease, rectal prolapse. Ladies may have pelvic floor damage. It can lead to syncope. It can lead to agitation in dementia patients. And of course, another very important thing can happen because of this, and that is SIBO. That is small intestinal bacterial overgrowth. As you are aware, the small intestine is very clean. It does not have any bacteria. But when constipation becomes chronic, then the same pathological bacteria from the colon may go up into the small intestine and cause lots of complications. And this SIBO is a cause of many other very serious complications. So to avoid that, we need to take constipation very seriously. Then, of course, it can lead to neurological problems. It is known that people who have Parkinson's disease give a very strong history of constipation in the past. So constipation can both be an effect as well as a cause of Parkinson's disease. Then the most important thing about which Ayurveda has always talked about is that constipation can lead to accumulation of a lot of toxins in the body. And I'll discuss these toxins in a little detail just after this. And lastly, but not the least, prolonged constipation can lead to cancer, especially cancer colon, etc. Next one, please. So when there's an accumulation of toxins in the body, the toxin lead to chronic inflammation, and chronic inflammation, as you now know, is a cause of most chronic diseases. And next one, please. And Ayurveda has always talked about this, but in a different form. Ayurveda has been talking about arm. Now, arm is undigested food. It may be because of emotions, can be because of many other factors, toxicity. There are many factors which we can discuss subsequently. So, arm is what we now talk as, talk in terms of toxins. And this arm can lead to change in taste. It can lead to diarrhea, constipation, vitamin deficiencies, bloating, gas, almost anything. Next one, please. So the question now is, why does it occur? The basic fact is, the basic cause behind it is incomplete digestion. So again, we come back to the same thing that the gut is very important. So we need to understand the process of digestion, which I'm sure everybody knows, but there's no harm in briefly recapitulating it and going along discussing the causes on the way as you do so. Next one, please. Now, you know very well that digestion starts in the mind, which again is what we learned from ancient sciences. When the food is being cooked or when you smell the food being cooked, then your mind starts acting. The mind leads to the production, the brain leads to the production of salivary juices from the salivary glands. When the food comes into the mouth, the salivary glands produce saliva which acts on the food stuff. And this is important for the digestion of carbohydrates and starches. So proper chewing is very important. It is said in the ancient sciences that food should be drunk like water and water should be eaten. It is considered to be that important. Next one, please. So if the food is not chewed properly, it leads to inadequate digestion, which then leads to constipation. Next one, please. Now, then the food comes into the esophagus, and in the esophagus, uh, it has to move down, and this happens because of what is known as peristalsis, which we are all familiar with. So as the food bolus come into the esophagus, the esophageal muscle acts upon that. It contracts at various points, trying to push the bolus down into the stomach. And this act of peristalsis is controlled by the vagus nerve. So again, the brain comes in, and it is very important for that. And the vagus nerve, therefore, plays a very important role in peristalsis, which may be maybe in the esophagus, maybe in the small intestine, large intestine, wherever it may be. So the vagal tone is very important for this. Next one, please. Now, then the food, as I already mentioned, the importance of the vagus nerve, and the vagus nerve, as you know, is related to the parasympathetic system. And this can be, the vagal tone can get reduced because of stress, because of anxiety, emotional disorders, etc. So all of these things, the mind playing a very important role. They are both mechanical reasons as well as mental reasons. Next one, please. Now, movement, as you know, I must mention this, movement, as you know, is a basic principle of nature. We know that there are three basic principles in nature: movement, transformation, and structure. So when the food bolus moves properly, it is only then that further transformation can take place. By transformation, what I mean to say is that transformation of this food after absorption of the foodstuff and the nutrients from the food helps in changing of production of new cells. Now, as you know, the intestinal cells are the most rapidly growing cells in the body. They need good nutrition for proper growth to take place. See, the movement of the food is not adequate or it is not proper transformation of food substances will not take place, which will then hamper growth. So this basic principle of movement is very important, and movement has to be flowing in nature. Wherever there is obstruction, wherever there is sluggishness, it is bound to lead to problems, and in this case, can lead to constipation. Next one, please. Now, as the food comes into the stomach, we are all aware of all this. These are all basics which everybody knows. But I am purposely mentioning those because these all add up to the causes of constipation. Now, when it comes to the stomach produces what is called hydrochloric acid. This is produced by the parietal cells of the stomach. And this, as all of you know, is extremely important because Ayurveda talks of this in the terms of Jatragni. Jatragni has got to be adequate for proper digestion to take place. Next one, please. And this hydrochloric acid is very important for digestion, especially of proteins. It leads to the production of pepsin, and this is important for stimulating the production of bile and other enzymes from the pancreas. It activates the intrinsic factor, therefore important for production of vitamin B12. We know all about that. It is also important for the closure of the esophageal sphincter at the top and opening of the lower sphincter. So if there's not adequate acid, then both of these are going to suffer. Food will accumulate in the stomach shuts down, the pylorus closes down if there's inadequate acid, the esophageal sphincter remains open, as a result of which this acid and the food stuff goes up into the esophagus. And that leads to peptic esophagitis and things like that. Next one, please. So low stomach acid can lead to incomplete protein digestion, indigestion, and ultimately constipation. Next one, please. Now, how do we know that we are deficient in hydrochloric acid? There are various symptoms which suggest that a person could be low in that acid, and that is like bloating, indigestion, feeling of excessive fullness after meals, gastroesophageal reflux disease, deficiency of zinc, copper, magnesium, B12, dysbiosis, irregular bowels, constipation, diarrhea, undigested food in stools, recurrent intestinal infections, bad breaths, and weak or cracked nails. So, if there are any of these signs, it suggests that a person is low in hydrochloric acid. Next one, please. Now, as the food comes from the stomach into the small intestine, as you know, the small intestine has three parts. It has the duodenum, it has the jejunum, and it has the ileum. Now, as it comes into the duodenum, the food is then acted upon by pancreatic juice as well as bile. Now, as you know, bile is produced in the liver but stored in the gallbladder. So both of these then act on the food, and therefore, if there's inadequacy of the pancreatic juices or there's inadequate bile production, which may happen because there's something wrong with the gallbladder or the liver. When that happens, then again a problem takes place, which may lead to improper digestion, leading to constipation. Next one, please. Now, when the food comes into the small, that is the ileum. Now, ileum, as you know, is basically sterile, but it has a huge surface area because of what it contains are villi. Now, these villi are important for the absorption of food. So, you know very well that 90% of the absorption of food takes place in the small intestine. If there's anything wrong with the villi, now the common thing which happens is that if the villi are not functioning well, in that case, there will be proper absorption will not take place. And this, as I mentioned, no, just stay on that, please. Inadequate absorption takes place, which can also be contributed because of inadequate motility. And of course, stress plays a very important role in this. Now, the purpose of villi is that, as I mentioned, they help in the absorption of food. The small intestine has a small layer of endothelium, and this endothelium needs to remain intact. Now, if it gets broken down, and that happens when when we have different, I'll discuss this later, that different types of food produce different types of problems. The endothelium may break down, and the breaking down can lead to other complications known as leaky gut. Next one, please. Now, this is what I'm talking about. Now, the small intestine has a number of cells. As you can see, there is no gap between these cells. These are known as tight junctions, and this is a normal situation. So when the situation is like this, then what happens is that only those molecules of food which need to be absorbed will go into the regular digestive tract. They'll go into the liver, where they'll be metabolized and all that. But if for some reason there is a gap in between these tight cells, these tight junctions, then a condition develops known as leaky gut. When that happens, the food does not follow the regular channel of digestion, and the abnormal bacteria act on the food, producing abnormal chemicals, and large molecules then go up into the bloodstream. They go directly into the bloodstream through the endothelium, and this then circulates in the body, and wherever it goes, to whichever part of the body, one develops diseases. So this is what is called leaky gut. Next one, please. And then after this, when it comes into the large intestine has millions of bacteria, viruses, fungi, and all that, and they of course serve a very important purpose. So as you can see, that peristalsis plays a part in the esophagus, it plays a part in the intestine, the small intestine, and the large intestine. So when the food comes into the large intestine, it must be acted upon by peristaltic movements for the food to be propelled down and then finally to be evacuated. And it is here, next one please, and it is here in the colon that a lot of things take place. One, uh, it absorbs a lot of water. So if there's inadequate hydration, the colon will not function very well, leading to constipation. If that decreased peristaltic movement, then also the same thing happens. And if the healthy microbes, which are in huge quantity in the colon, if they get destroyed for whatever reason, then again constipation develops. And lastly, the colon is important for fiber. Now, when we have inadequate fiber in our diet, then these bacteria do not get their food, the healthy bacteria. That means the abnormal bacteria come to the fore and they then start acting on this, and proper propulsion of the food does not take place, whatever is present here. So these are four important reasons how colon plays a role in constipation. Next one, please. Now, therefore, the causes are dehydration is a very important cause. If we do not drink enough water, then the colon will be extracting more water and the stool will become very hard and difficult for it to move. Next one, please. Then, of course, destruction of gut microbes. I just alluded to this in the beginning, but the microbes, which are the healthy microbes present in the gut, that is mainly the large intestine, now these get destroyed. And this destruction takes place because of a host of problems. And we are being exposed to each one of them every day, day in and day out throughout the year. The most important are antibiotics and painkillers. Now, people have been taking antibiotics just like that on the drop of a hat. All of these antibiotics are known to destroy the gut bacteria, and when the destruction takes place, you have lots of digestive problems, including constipation. Then taking contraceptive pills, sleeping pills, steroids. Steroids are another very important cause of destruction of gut microbes. Use of cytotoxic drugs, radiation, processed foods, prolonged stress, alcohol, chemicals, cosmetics, radiation, pollution, pesticides, heavy metals. Heavy metal is something which is not really thought of, and I know that heavy metals to some extent have been used earlier, but that was a time when we were not imbibing heavy metals from the atmosphere. Now, what is happening is that a tremendous amount of heavy metals are going into our system, both by ingestion as well as by inhalation. Because of that, we are accumulating a very, very heavy level of heavy metals in the body, and these are detrimental to us. We need to revise this entire system once more. Then, of course, abnormal electromagnetic fields like Wi Fi, television, etc. Next one, please. This can also happen because of pesticides, chemical fertilizers, chlorine. Even now in our country, we still use chlorine in a lot of places, because of which these gut bacteria get destroyed. Man-made chemicals, personal care products, soaps, deodorants, perfumes, detergents, industrial pollution, processed carbohydrates, sugar, soft drinks, sweets, bread. They lead to pathogenic bacteria, which I already mentioned before. Next one, please. Lack of fiber is a very important reason, but not the only one. And fiber, as you know, is very important. Insoluble fiber is important for the gut microbes. The healthy ones feed on this. And when they feed on this, they develop further and help in digestion. And fiber also regulates water content and provides bulk to the stools. And some even act as prebiotics. Next one, please. Now, there are certain blood tests through which we can detect whether their stomach acid is low. These are not routinely done, but you can suspect. If you have low chlorine, low chloride and phosphorus levels, abnormal serum protein levels, low levels of vitamin B12, abnormally large RBCs, high homocysteine levels. Now, I personally am checking practically all patients for homocysteine levels, and I'm finding high homocysteine levels in practically every single patient. There are many reasons for that, but one of the important reasons is low stomach acid. Low alkaline phosphatase levels is also an indicator of low acid. Next one, please. Now, there's sometimes constipation can be caused because of factors about which you don't even think of sometimes. And one of the important ones is hypothyroidism. Hypothyroidism, I'm purposely mentioning here because it is almost always overlooked as a cause of constipation, or for that matter, any gut issues. In hypothyroidism, as you know, that the entire system is sluggish, the gut also becomes sluggish, leading to constipation. Now, the problem here lies is that when you check for thyroid functions through a blood test, that is woefully inadequate and does practically never gives us the correct diagnosis, for the simple reason that in Western medicine, only the TSH is high does one think of hypothyroidism. And there again, TSH levels in the lab up till 5 are considered to be normal, but the reality is any TSH level more than 2.5 is abnormal. So whenever the TS level is on slightly on the high side, we should suspect and go in for some other tests. The other tests are not done in Western medicine at all. There's a very simple test called a thyroflex test, which checks the neurotransmitters because the thyroid gland affects the neurotransmitters of the body. And thyroid function depends not only on the thyroid as such, but it depends on the adrenal gland, it depends on vitamin D, it depends on vitamin B12, pregnenolone, it depends on DHEA, it depends on iodine, it depends on melatonin, it depends on CoQ10. There's so many factors, and this thyroid test checks all of these. And based on that, I'm picking up a lot of patients with hypothyroidism who are not even suspected to have hypothyroidism. So I repeat, hypothyroidism is a very important cause of constipation. Next one, please. Then diabetes. Now again, lots of people with diabetes have constipation, and the reason is that diabetes affects the splanchnic nerves, the gastric nerves, and leads to a condition called gastroparesis. And this affects the intestines as well. So diabetes is also an important cause of constipation. Next one, please. Magnesium deficiency is something we don't even think of, and we rarely check for it. But believe me, most of us are deficient in magnesium. And this can happen because of stress, which is universal, caffeine, sugar, and the presence of toxins in the body. Next one, please. Then Parkinson's disease, I've already mentioned about that. Next one. There are many medicines, I've already mentioned this, but I briefly mention again antibiotics, antihistaminics, opioid pain relievers, beta blockers, non-steroidal anti-inflammatory agents, tricyclic antidepressants, calcium supplements, proton pump inhibitors. Now, proton pump inhibitors are a very important cause, and proton pump inhibitors like PAN and PAN 40, etc., are being used universally by our Western medicine colleagues, unfortunately. Now, even the inscription on the medicine mentioned that they should not be used for more than 2 weeks. But I've seen patients taking them for years together, which can be a very important cause of constipation. And of course, just a word of warning, we should never stop these immediately. We should treat the cause and gradually taper them off. Next one, please. Then functional constipation. Now, this is something which is again, when we're talking about mental constipation, this is something similar to that. Now, stress plays a very important role. And the most important thing out here is that you see a lot of children with constipation and even adults. And the reason behind this is that if you do not go to the washroom, if you want to evacuate, but you don't want to go for whatever reason it may be, if you're in a hurry or you have some work to do, you often postpone that. And that leads to a condition of chronic constipation. This can also happen because of lack of physical activity. So remember, holding on and not going to the toilet is another important reason why constipation occurs, very common in children. Because children nowadays have to go very early in the morning, and early in the morning they may not feel like going to the washroom because of inadequate diet. If they don't do that, the condition becomes chronic. Next one, please. Next one. Now, stress, I've already mentioned about that. Now, stress, that is a universal phenomenon. It affects practically every system in the body. It can affect the esophagus, the stomach, and the bowels. And as I mentioned, it is a very important cause of constipation. I will not go into details of this because I'm sure everybody is aware of it. Next one, please. Now, repressed emotion is something which we don't think of. Again, it has something to do with a lot to do with stress. Now, that is why a term has come up called emotional constipation. That is holding back your anger, rage, depression, anxiety, grief, disappointment. That means not giving vent to your feelings. If you don't do that, either you don't give vent to your feelings or you do not have alternative channels of removing that negative energy from yourself. This is called emotional constipation, and this is an important cause of constipation. So, very often there are people who have a personality of storing things, hoarding things, holding on to everything. When they do that, they often suffer from this constipation at an intuitive level. Next one, please. So I just want to remind you that we are interconnected. Every system is interconnected. So our feelings and emotions, they affect the cardiovascular system, they affect the immune system, the nervous system, and the GI tract. And each one of them feeds onto the other. So if you have a cardiovascular problem, you can have a GI problem. If you have a nervous system problem or an immune problem, that will affect your gut also. And then all of these, this entire cycle can lead to conditions of constipation. Next one, please. Now, negative emotions, I've just mentioned a little more. Now, you know very well that the Mooladhara chakra is related to the emotion of fear. Now, when you are afraid of something or you're extremely fearful about something, then this affects imbalances the Mooladhara chakra. And when the Mooladhara chakra, which is at the root, that is the base of the spine, if that is not functioning well, it affects excretion and evacuation, leading to colitis and constipation. Similarly, if you are very angry, when you're angry, that means your Manipur chakra is imbalanced. When that is imbalanced, digestion is going to suffer. And when digestion suffers, it leads to peptic ulcer and indigestion, further leading to constipation. So as I mentioned, everything is interconnected. Next one, please. So what do we do? How do we manage it? One, remove all those things which are inflammatory, all those things which produce toxins in the body, all those things which reduce the motility of the gut. So to start off first, take off all refined food from your diet. First is, of course, avoid sugar. Next one, we know all about that. We've discussed it. Avoid all processed foods. Next one, I'll go through this rapidly. Avoid processed carbohydrates, as you can see here. Next one, all of these contain a lot of sugar. All of these soft drinks contain a lot of sugar, so that is very harmful. It is a very important reason for constipation. Next one, please. Then, fast food leads to what is called early deaths, and this is a fact. Next one, please. Now, technology has also been fooling us. Now, they developed something known as bliss point technology, which means that the food industry has now been working on making whatever they make more and more tasty. So, since they are all very tasty, so we tend to consume a lot of them. Because nowadays, 90% of us go for food which is tasty rather than the food which is nutritious. And therefore, this is spiraling up and leading to conditions of constipation and so many other problems. And therefore, technology is now making more and more ultra processed foods and making them taste better, which is very bad for us. Next one, please. Now, wheat. Wheat is something which a lot of people do lots of debates on, but we are across the board advocating not eating wheat for various reasons. There's a long history of wheat. I'll not go into all of that. Suffice to say that wheat came into our consumption 12,000 years back. And prior to that, people were nomadic. They were eating from the soil, whatever was grown in whatever season, but they were not growing wheat to that extent and hardly ever eating wheat. They were eating other things. And they were absolutely healthy. They had absolutely no problems, neither mental nor physical. But ever since wheat came into being, problems started, which have become now compounded for the last 50 years when wheat is being ultra processed. The wheat which we are getting is not the same wheat which we had about 100 years back, which are not so bad. But now this wheat has a lot of problems. It is leading to so many complications. It contains a gliadin protein. It also contains WGA glutenin, and all of these are very common. So now, one of the things which we are now doing is we are trying to check for wheat sensitivity in most patients, wherever if they have any chronic problems. Next one, please. Next one, please. Similarly, milk. Milk is also, I have been propounding the fact that milk is not meant for human consumption, especially the milk which we have now. The milk which we had about 100 years back contained A2 casein, which is not so bad. But the milk which we get now is adulterated. It has a lot of abnormal protein and contains A1 casein. A1 casein is very bad for us. Next one, please. So the thing to remember is eat healthy, locally grown, seasonal, organic, fresh, and natural food, and eat at the right time. Next one, please. Increase the intake of fibers, as you can see in this picture. All of these things are good for you. Broccoli, cabbage, cauliflower, nuts and seeds, especially flax seeds. Next one, please. Then prebiotics and probiotics in the food like garlic, onion, psyllium husk, fermented foods like yogurt. We know all about that. As doctors, I'm sure everybody is aware of this. But remember garlic, onions, and things like that. Then healthy fats. Healthy fats are very important for us because the gut bacteria, next one please, the gut bacteria produce butyrate, and the butyrate is produced by the ghee which we consume. So all the healthy fats are good for us because we know very well that every single cell in the body needs them. So increase the intake of ghee, MCT oil. MCT oil comes from coconut oil, cold pressed coconut, virgin oil, extra virgin olive oil, and avocados. These are very good for all of us, and each one of us should be consuming it. Believe you me, these will not increase your, will not contribute to obesity or to any problem whatsoever. Next one. Supplement magnesium if there is constipation. Magnesium comes in many types of salts, but the important ones is to take magnesium citrate. Magnesium is also present in a lot of foods like vegetables, green vegetables, nuts, seeds, dry beans, dark chocolate. But when you take dark chocolate, remember that the dark chocolate should contain at least 70% of cacao, CaCao, not cocoa. Sometimes they mention that it has cocoa, and we think that cocoa is good. Cocoa is not good for us. Cacao is what is good for us. Avocados, legumes, etc. we can take. So if you need to give a supplement of magnesium, it needs to be magnesium citrate. And the dose will vary. You can start with a low dose, but then you may have to go to almost 1000 milligram a day. Next one, please. Vitamin C is also important, and here again the dose is pretty high. If you need to give vitamin C, you can get 2000 to 4000 milligram per day along with magnesium. Next one, please. Hydrate well, drink a lot of water, at least 6 to 8 glasses of water every day. Next one. Almond oil is good for you. At night, you can have a tablespoonful of almond oil for a month or so. That will help your constipation. Next one. Munakka, this is something which we have always known in our country. Next one. Exercise is, of course, very important. We know that, but the exercise should be non-competitive, like walking or swimming. Next one. Follow the rhythm of nature. An early dinner. Now, this is something which has always been advocated by Ayurveda. An early dinner, early sleep, getting up early, because Vata is still strong in the early morning, and this is conducive to a good bowel movement. So early morning when you go to the toilet, it practically always helps. But now mostly what is happening is people are sleeping late, getting up late, so they have skipped that period, and that further leads to constipation. When you get up in the morning, stretch, do some stretching or the other. Even dogs and cats do that when they get up. Next one. Now, vagal stimulation is something I had mentioned before, and yoga has described many face techniques called face yoga. There are many types of them, which perhaps we might discuss later. That is very good because that helps in improving the vagal tone and also is very relaxing. Next one, please. Yoga and pranayama, you know very well, are very effective. Next one. The very specific asanas for constipation like Pavan Muktasan, Ardhvakrasan, Marjari Asan, Bal Asan. Next one, please. Surya Namaskar is another very important one because this not only it is a combination of 12 asanas affecting all systems of the body. In addition, it affects the vagus nerve also, which is quite good. Next one. Then Kag is something I must mention about because this is something which we in the cities have forgotten about completely. If you see people living in the villages, when they are resting, sitting, they are sitting like this only. And this is extremely good. It is very conducive to the gut. So I would recommend that if you have to rest, please do so in this if you can do so, because this is a dynamic way of resting. If you sit on a chair or you sit on a sofa, then that is not dynamic. In this way, all your muscles are getting active. Pranayams, diaphragmatic breathing, Anulom Vilom, Kapal Bhati, Bhastrika are very important ones for constipation. Next one, please. Meditation, of course, you know very well, alleviates the stress response. Next one. Meditating on the Manipur chakra, you know the mantra for Manipur is Ram. So if you meditate on that, you're stimulating the Manipur chakra, because of which you're stimulating the stomach, the liver, the pancreas, and the intestines. Next one. And of course, being spiritual. Now, this is something I just want to mention in a minute. Now, Dr. Westberg believes that the illnesses of about half to three-fourths of patients originate in problems of the spirit. Therefore, meditation is important. And according to Ayurveda also, forgetting our true nature is the root cause of disease. It also mentions pragnaprad. You know more about this than I do, but I thought I'd briefly mention it. Next one, please. So to conclude, change food habits, eat healthy, avoid artificial foods, no sugar, milk, wheat, drink enough water, stick to nature's rhythms, exercise regularly, yoga and pranayama, be spiritual, meditate. Thank you very much for being so patient.
Many thanks, Dr. Kohli, for simplifying it and enriching everybody on such a important topic. I'm very sure everybody in today's world at some point of time do suffer from constipation, and bringing in a different angle of emotional constipation, right? Which I think must be ears to some of the doctors, and which I think requires more integrative approach rather than the normal constipation that we have. So, Dr. Kohli, thank you so much. From Dabur, we have Dr. DP joining us. Dr. DP, welcome to the webinar. And may I request you to please take over from here and add the knowledge in terms of the management of the holistic constipation, sir. Over to you, Dr. DP.
Yeah, thank you, Anuj. Dr. Kohli sir, good afternoon, sir. It's
Good
nice
afternoon.
to see you back. And in fact, I couldn't see you in the last couple of meetings. I was busy in some other assignments. But it's a great listening to you, sir. It's always enriching with a lot of data and lot of information, inspiring information. In fact, it's we can't go away from the system while you are presenting the lecture. So it's very insightful.
Thank
Thank
you.
you.
Thank
Thank you very much, sir. Well, thank you, Anuj, for introducing me. Uh, see, Dr. Guli sir already mentioned here. Actually, constipation, earlier also we discussed, is constipation itself is not a disease. It is a symptom in various conditions. So, and as Kohli sir rightly mentioned, if it is not treated, if it is not attended properly, then it will lead to multiple complications or multiple other problems, health problems. So, while it should not be ignored at any cost, but if you see constipation, it appears to be very simple. अरे ये तो constipation है, ये तो ठीक है आज motion नहीं हुआ. But it appears very simple. But constipation, habitual constipation, is going to cause a lot many health problems. As in Ayurveda, in medical science, it is believed that most of the diseases starts from the stomach itself. So if the stomach is taken proper care, then if the gut is taken proper care, then most of the diseases will be cured or controlled on their own. So that's one of the principles which we have been listening, or which we were taught while in the medical science. So, as Kohli sir mentioned, one of the key problems, or one of the key uh, reasons for this constipation is accumulation of ama. Accumulation of ama is one of the key reasons. Of course, there are many other reasons. And now the problem is why this ama is forming. First of all, in medical science, in Ayurveda, it is very clearly mentioned, Midyahar Viharabhyam, Dosha Amasya. Midyahar, Vihar. Ahar and Vihar. These are the two very key elements mentioned in any medical science. Even now, while many of the doctors are aware, in every super specialty hospital, there is a dietitian, there is a nutritioner, there is a counselor, along with other super specialty wards. So every patient is directed to the dietitian or the nutrition counselor, where they will guide the proper diet, where they will provide the what the nutrition should be taken, what kind of exercise someone should take. So, as Kohli sir mentioned, one correct word is uncompetitive exercise. So this is one important thing, because we have been seeing in the parks and the gyms or many areas, many people starts competing. अरे मेरे से छोटा बच्चा इतना ज़्यादा एक्सरसाइज कर रहा है तो मैं क्यों नहीं करूं, या मेरे से छोटी एज की लड़की लड़की करे तो मैं तो मत दूं, मैं तो मेल हूं, मैं तो और ज़्यादा कर सकता हूं. तो एक कॉम्पिटिटिव में जाके अननेसरी वी एग्जर्ट अवरसेल्व्स एंड लैंड इन प्रॉब्लम्स. We have seen in many conditions. Even now, most of you might be listening to the news. The famous comedian Raju Srivastav was admitted at AIMS. One of the reasons is may not be constipation, but excessive exertion. At the treadmill, he is doing excessive exertion, because of which the pranavayu has damaged the cardiac muscle, and cardiac arrest he suffered, plus other various. So what I meant to say is there is a competitive exercise that should be completely controlled. भाई मेरे कैपेसिटी क्या है पहले वो तो जानो. If I can able to walk only 100 feet, let's start with 100 feet only, 100 steps only. Let's start with 100 steps, gradually improve to 1000, 10,000, 5,000 somewhere. On the first day one itself, मुझे गूगल में नॉलेज मिल गया 10,000 स्टेप्स पर चलने से मुझे बहुत अच्छा होता है. If I start walking 10,000 steps because of a Google doctor, we will land in problems. So that is called a Midyahar Vihar. Midya Vihar. मिद्याहार एवरीवन नोस. मेरे दोस्त की शादी है, मेरे बहन की शादी है, आज बहुत कुछ खा लिया मैंने बॉस, आज नहीं तो कल नहीं मिलेगा खाना, तो खा लिया, देन वी लैंड इन प्रॉब्लम्स. सो इस मिद्याहार विहार में क्या होता है, अतियोग भी है, अयोग भी है. बिल्कुल नहीं करना भी मिद्याहार, ज़्यादा करना भी अतियोग, अयोग, संयोग. सो मेडिकल साइंस ऑलवेज बिलीव्स दैट संयोग इज द वन थिंग विच इज रिक्वायर्ड. ना अयोग होना है, ना अतियोग होना है. एक्सरसाइज करने से मुझे हार्ट बीट बढ़ जाता है तो करके एक्सरसाइज नहीं करके घर पे बैठने से प्रॉब्लम है. एक्सरसाइज तो करना ही, वॉक तो करना ही है, लेकिन यू शुड नो योर लिमिट. इसलिए आयुर्वेद में क्लियरली मेंशन्ड है अर्धशक्ति व्यायाम. अर्धशक्ति व्यायाम, हाउ डू यू नो योर कैपेसिटी? इट इज अर्धशक्ति. द मोमेंट यू गेट स्वेटिंग ऑन द फोरहेड, ऑन द axilla, that means you have exhausted half of your capacity. Stop the exercise there itself, don't go beyond, and then start increasing the capacity. So that's how the science believes. So this Midyahar Vihara is a sloka. The quotation is very simple, but there is a lot of meaning for this Midyahar Viharabhya ka interpretation. So that's one thing which we should educate our patients or educate our consumers how to deal with the lifestyle problems. And well, there are Kohli sir had mentioned many diet regimens, many fruits, magnesium खाना है, vitamin C लेना है, blah blah blah, everything. There is a very simple principle in Ayurveda, very simple, which I have been recommending to many patients. Many patients or many of my friends or many of my colleagues in my office, and most of them are practicing and they're very healthy. Touch wood, they're practicing that. The simple principle is भोजनाग्रे सदा पथ्यम लवणाद्रक भक्षणम. भोजन से पहले, भोजनाग्रे, भोजन से पहले सदा पथ्यम, हमेशा, फॉर एवरीवन, मेल फीमेल, बच्चा बड़ा जो भी है, भोजनाग्रे से सदा पथ्यम लवणाद्रक भक्षणम. छोटा अमाउंट में लवण और छोटा अदरक, छोटी मात्रा में, नॉट इन वेरी हाई क्वांटिटीज. आधा घंटा पहले, खाना से पहले छोटा थोड़ा सा मात्रा में लवण और अदरक लेने से क्या होता है, अग्निसंदीपनम. भोजनाग्रे सदा पथ्यम लवणाद्रक भक्षणम अग्निसंदीपनम. अग्नि डाइजेस्ट फायर स्टिमुलेट होता है, सो दैट वाट एवर यू ईट इट गेट्स डाइजेस्टेड. अग्निसंदीपनम. रुच्यम, जो आप खाओगे इसमें रुचि बढ़ेगा. अग्निसंदीपनम रुच्यम, जिह्वा कंठ विशोधनम, जिह्वा और कंठ का शोधन होता है. सो सिंपल प्रिंसिपल है, कुछ ज्यादा मेडिसिन नहीं लेना है. कोई भी डॉक्टर यू कैन गिव इट टू मेनी ऑफ योर कंज्यूमर्स. लवण में इसमें ब्लैक साल्ट इज आइडियली रिकमेंडेड बिकॉज the other sodium chloride is may not be suitable for the hypertensive patients. So black salt, which contains a low amount of sodium chloride, can be given. So black salt and छोटा में अदरक. तो हम लोग प्रैक्टिस करते घर पे छोटा सा मात्रा में अदरक और छोटा सा नमक लेके ऐसे चबाना है आधा घंटा पहले. दैट इज वेरी गुड फॉर द पीपल. लेकिन इसमें एक प्रिंसिपल और भी है. कोहली साहब ने बिल्कुल सही कहा, आपने भी अभी अनुज ने भी सही कहा. जैसे क्या कहता है, द कॉन्स्टिपेशन जो है एक तो हैबिचुअल है, एक वी शुड कॉन्सेंट्रेट ऑन व्हाट यू आर ईटिंग. इसके आयुर्वेद में एक कोटेशन है, तमन्ना भोजनगता चित्ता. तमन्ना मीन्स नॉट द तमन्ना भाटिया ऑफ द इंडस्ट्री. सो तमन्ना भोजनगता चित्ता मीन्स यू शुड कॉन्सेंट्रेट ऑन व्हाट यू आर ईटिंग. मोस्ट ऑफ द टाइम्स क्या होता है, हम टीवी में कोई मूवी देखते हैं, खाना खाते हैं, और वाइल स्पीकिंग सम अदर इलॉजिकल और हमको इरेशनल, रशिया यूक्रेन के वार के बात में बात करते हुए हम लोग खाना खाते हैं. वी हैव नथिंग टू डू विद द रशिया यूक्रेन वार, बट हम लोग उसके बात करते हैं. यार पॉलिटिकल का मोदी क्या करना चाहिए, राहुल गांधी क्या करना चाहिए. यार हमको क्या करना है, राहुल गांधी क्या करेगा, मोदी क्या करेगा. वी कांट कंट्रोल व्हाट मोदी डज. So what happens is, if you are deviating your mind from the food, so that disturb the digestion process. You should enjoy what you are eating. खाना खाते समय देखो क्या खा रहे हो. सबसे पहले आप देखे होंगे बहुत बार क्या होता है, बच्चों में देखे होंगे आप, बच्चों में ज्यादा होता है, कोई मोबाइल खाते होते खाना खाते हैं, आप पूछो भाई आपने क्या खाया, अच्छा छोटू क्या खाया खाना, वो देखता रहता है मैंने क्या खाया खाना, मैं क्या खाना खाया, भूल जाता हूँ एक्चुअली, बिकॉज हिज कॉन्सेंट्रेशन और हर कॉन्सेंट्रेशन इज नॉट ऑन द मील्स. सो concentrating one's mind on the food while eating, what we think, what we are eating is a positive thing. It gives a positive vibrations, and thanking the person who is giving the food. So that gives a positive thing. So that is one thing which is very important. एक और थिंग है इसमें ये पूरा करने के लिए, आई एम जस्ट गिविंग द लाइफस्टाइल एलिमेंट्स ओनली बिकॉज कॉन्स्टिपेशन एज कोहली सर सेड इज द लाइफस्टाइल प्रॉब्लम. पहले अपना लाइफस्टाइल को ठीक करना है, मेडिसिन कम्स ऑन द लेटर स्टेज. सो एक और प्रिंसिपल है, ब्राह्मे मुहूर्ते उत्तिष्ठेत स्वास्थ्य रक्षार्थम आयुष्य. दिस वन मोर प्रिंसिपल. ब्राह्मे मुहूर्त मीन्स सनसेट, सनराइज से पहले 1-1.5 घंटा 90 मिनट्स पहले उठना चाहिए. यूजुअली हम लोग बोलने के तो ठीक है, सब लोग बोल जाते हैं, बट उठते कोई नहीं. दैट्स द सेकंड थिंग. बट if you see most of the healthy people who are healthy, if you ask their lifestyle habit, lifestyle routine, their daily routine, everyone will 100% say they wake up at 4:30 or 5 o'clock. They do their normal routine and they do normal exercise. Most 100% of the people who are healthy, Manoj, आप और मैंने इसमें, we are exclusive of this. We don't wake up at 5:30. So, but what I'm saying is, why should we say there is a scientific reason? It's not because Ayurveda said. Why science said Brahme Muhurte Uttishtet? Brahme means 90 minutes before sunrise, because at that time the atmosphere contains almost 40 to 45% of the nascent oxygen, which is very important for our body. Because as you know, after sunrise, after 7 o'clock, pollution levels start increasing. So you don't get the pure oxygen or pure air. But in the early hours, at the between 5 to 5:30 or before sunrise, at that time the oxygen levels are very high, so that we can able to take that breathe here and do the pranayama what Kohli sir said, so that we can inhale positive air in the body that gives a positive health. ये एक छोटा सा प्रिंसिपल है, मैं अभी बताता हूँ. एक बहुत बड़े प्रिंसिपल है. आई थिंक वी कैन ऑल डू दिस. अभी while just listening to Kohli sir, I got an idea. So I searched some Sanskrit book. I got this quotation. It says, "Bhojanante pibet takram." I think it's very clear. Bhojanante pibet takram, vasarante pibet paya, nishante cha pibet vari, tribir roge na jayate. It means भोजनांते पिबेत तक्रम. भोजन का अंत में, खाना खाने के अंत में तक्र, बटर मिल्क लेना चाहिए. छाछ, हम लोग जो इसे बोलते छाछ, नॉट द लस्सी, छाछ. भोजनांते पिबेत तक्रम, वासारांते पिबेत पया. डे का एंड में, एट द एंड ऑफ द डे, पया मिल्क लेना चाहिए. भोजनांते पिबेत तक्रम, वासारांते पिबेत पया, निशांते निशांते च पिबेत वारी. Nishante means रात का एंड में. That means that ब्राह्मे मुहूर्त. What I'm saying, early hours of the day. निशांते रात का एंड में, that's the early hours. early hours से पिबेत वारी, पानी पीना है. जैसे अभी कोहली सर ने बताया पानी पीना चाहिए. पानी कब पीना है? Sufficient water पीना चाहिए. One of the very good principles कोहली सर said now. पानी कब पीना चाहिए? Early morning. पिबेत वारी, निशांते च पिबेत वारी. कौन सा पानी पीना चाहिए? तुषोदके. बहुत अच्छा प्रिंसिपल है. तुषोदके मीन्स ल्यूकवार्म वाटर. क्योंकि ल्यूकवार्म वाटर पीने से क्या होता है, while sleeping in the entire night, because the AC or cold condition, our body becomes stiff, arteries become stiff. So early morning, at the Brahme Muhurte, 5 o'clock or 5:30, if you take a little bit of lukewarm water, a glass of lukewarm water, the arteries are dilated. Blood circulation improves, so that your heart or the digestive system, everything improves. That's one of the reasons. That's how we might prevent the early morning cardiac strokes. That could be one of the reasons. It's not one of the reasons, but it may help in preventing the early morning. Because if you see, cardiac attacks happens mostly in the early morning, because over the night the body gets stiffened, there is no activity, arteries constrict. So to dilate, and people, what happens, alarm ring ho gaya, suddenly we wake up. That suddenly waking up will disturb the hypertension. So because while we are in the supine position, if you woke up immediately, the blood circulation will not be habituated to that, so it might cause a hypotension. So the BP might fluctuate, and most of the times people get into collapse at that time. So after waking up, don't wake up suddenly. Wake up, sit for some time, let the body adjust for the temperature, body blood pressure, and take a little bit of lukewarm water. निशांते च पिबेत वारी. त्रिभिर रोगे न जायते. कोई भी रोग कभी आने का ऐसे सवाल नहीं होता. So this is very good principle. So one of the very good principles I got, and we should practice this. भोजनांते पिबेत वारी, भोजनांते पिबेत तक्रम, वासारांते पिबेत त्वया, निशांते च पिबेत वारी, त्रिभिर रोगे न जायते. So these are the one simple principles which we have in Ayurveda to take care of the lifestyle problems and prevent gut related issues. Because as I mentioned in my earlier talk, gut is the most critical part in our body. It's also sometimes called, it's also the second brain of the body. Gut is also referred as the second brain of the body, because that controls the entire system of the our human systems. तो अब आता है आम पाचन करने से मोस्ट ऑफ द डाइजेस्टिव सिस्टम्स गेट्स क्लियर्ड. अब आम पाचन करने के लिए हमने बहुत सारे चीज कर लिया. नाउ इफ एट ऑल देयर इज एनी मेडिकल कंडीशन इज रिक्वायर्ड, इफ देनी सम मेडिसिन हैज टू बी यूज्ड, of course Kohli sir has mentioned many recipes which we can take care of. बट इसमें एक आयुर्वेद में एक बहुत अच्छा मेडिसिन है, बहुत ही रामबाण जैसा औषधि कह सकते हैं हम इसको. दिस कॉल्ड चित्रकादी वटी, which most of the Ayurvedic practitioners know, and most of the practitioners do recommend to their the patients. The name itself is Chitraka. Chitraka means is a plant. Synonym of Chitraka, if you see, you will surprise. Many of the doctors who are listening to my presentation might be aware already. Chitraka synonyms are Vahini, means fire. Agnika means fire. Agni Janani, Vahini Rakshani. So there are many symptoms of Chitrak. So I'll just Anala. Just a minute. Some. So the symptom, I just got it full, sorry. So the synonyms of Chitraka, if you see, Anala means fire. Dahana means which can burn. Vahni Sanjanaka, Agnika, Hulasana. So there are many symptoms of Chitraka which are for fire. And there is a mention in Ayurveda, if somebody picks a Chitraka plant without gloves, even their hands will burn, the palms will burn. So that is the potency of Chitraka. So this Chitraka Vati is very good to digest that ama and improve the digestive system. Because I believe in constipation, we should not treat the constipation, we should treat the digestion. If the person's digestion is good, constipation will not occur, because constipation treatment is not recommended. Constipation, because we have many laxatives, purgatives, drastic purgatives, etc., emollients, etc. Though for those are recommended for the people for whose intestinal movements are not good. The peristaltic movement hoga, pendular movement hoga. If the movements are not, like, for example, in paralysis, already patient is under paralysis, the peristaltic movements are hampered, or the intestinal movements are hampered. So in those conditions, there could be some constipation happens, and in the pregnant ladies, there is a chance of getting a constipation, and we can't advise them to go for a walk or do exercise, etc. In those conditions, there is some mild laxatives are recommended based the condition. Is the goal like conditions they are recommended, which are good for safe for the pregnancy also and for the constipation also. But otherwise, the Chitraka vati, as I mentioned, is wonderful medicine to digest the amasya, to digest the ama and take care of the digestion. If the digestion is good, no problem of any constipation. Recently, we launched a product called Amapacha Kadha. This is a काढ़ा, the liquid आम पाचक. द नेम itself is आम पाचक. जो आम को पाचन करने वाला काढ़ा है, इसके अंदर अभी जो कोहली सर ने बताया था, जो जो इंग्रेडिएंट्स, विटामिन सी भी है, अजवाइन भी है, सौंफ भी है, पिपली भी है, चित्रक भी है, all digestive ingredients, digestives and carbonations are included here and put it in the liquid form, which is easy to take. So आम पाचक काढ़ा is one more thing apart from चित्रका दी वाटी. Then of course isabgol everyone knows. Nothing to again reiterate the beneficial effects of isabgol. The good thing of isabgol is it is also safe in pregnancy, which is very well documented, and this is also good. As कोहली सर ने एक इंडिकेशन रीजंस में बताया था etiology में, one of the reasons is obesity also, overweight also, cholesterol में जिसमें hyperlipidemia or cholesterol, obesity, overweight is one of the reasons. So isabgol also reduces the excessive weight. It has clinically documented to reduce the triglycerides and the cholesterol. So for the obese patients, for the people who are having that habitual constipation, तो इसको ना, there are many patients without taking a laxative, they don't get the stools, proper stools in the morning. So those people might go for the safe laxative like isabgol. बट इसका कुछ कॉन्ट्रा इंडिकेशन का हैबिट ऑब्स्ट्रक्टिव कॉन्स्टिपेशन में शायद इसबगोल यूज नहीं करना चाहिए. देयर इज अ कॉन्ट्रा इंडिकेशन दैट शुड बी टेकन केयर with the proper diagnosis. So that's one thing, isabgol. So isabgol pe, as most of the people know, Dabur has many variants. Nature care double action. So isabgol clubbed with senna for the people who are having a chronic constipation. Senna is a purgative, as most of you know. So while isabgol is a bulk forming laxative, senna is a drastic purgative. So we have clubbed it bulk forming laxative and a senna here in a limited quantity, so that the chronic constipation patients or the habitual constipation patients, they can take natural care double action here. And recently we launched the Cubsover as a product. Cubsover contains almost 50% of the isabgol, so that should be taken with care. The people who are sensitive to senna, they should be taken with the care. So that's one more thing we have. So these are the, and of course in Ayurveda most of the people know many medicines, like Abhayarishta is one of the common medicine which people recommend in constipation. Abhaya means haritaki. Haritaki, the synonym of haritaki is abhaya. Haritaki means terminalia chebula. Chebulic acid इसके अंदर होता है. This chebulic acid stimulates the intestinal movements, so that the obstructive fecal matter gets the movement and it gets evacuated. So that's why it's called abhyarishta haritaki. इसका one of the synonym is chetaki also. There are many varieties of haritaki. Chetaki is one of the variety which is given for the laxation, because it's more it properly facilitates the proper movement. So these are the medicines in Ayurveda. Apart from many other, of course, this is not the. If you start listing the constipation medicines, we will require one complete lecture about it. But the idea of here is, as Kohli sir had guided very nicely, that it is a lifestyle problem. First address the lifestyle, then come to the medicine. So that's one important thing which I would like to share with all the doctors. Guide all your patients for the lifestyle correction first. Then, of course, there are many principles which we can take it to the doctors. Thank you, Anuj. Thank you for giving me some time.
Thank you. Can I ask a
Many
question?
thanks.
Yes, sir.
Yeah,
Sorry, sorry.
please,
Can
sir. Please.
isabgol be habit forming?
Sorry, sir. Sorry.
Is isabgol habit forming also?
No, no, no,
Can
no,
people
sir.
take it for months together? It will not cause any harm?
No, no, no habit forming.
Okay. And what is the right time to take it? Is it morning or night before going to sleep? What is the correct time to have it?
Right time is, sir, night before going to meals, a
Hmm.
glass of lukewarm water, mix 1 spoon of 5 grams of isabgol, mix it thoroughly, brisk mixing is required because isabgol is a bulk forming, it forms a lump immediately. So if we
Yes,
wait,
yes.
it will form a lump, it will be difficult to take. So brisk mixing and take it immediately to before meals so that the water absorption will be there, and in the morning we will get a proper bowel evacuation.
And should you be soaking it for a longer period of time, like soak it in the morning and have it at night? Is that
No, no, no,
required?
sir. No, no, no. Then it will not be able to take it. It becomes a hard lump. It should be
Okay,
taken immediately. It should be mixed in
okay,
the water and should be taken immediately.
right, right.
We cannot keep it even for 2 to 3 minutes. It will form a hard lump. That lump will be
Okay,
not be able to take it.
okay. And
Otherwise, in IBS also we will find the same problem. In IBS conditions, we will have the same constipated related issues. So in IBS, what we recommend is isabgol mix it with curd. So,
okay,
3 to 5 grams of isabgol, mix it with curd. That can be taken. That can be taken in the morning, which will address the because as you mentioned, curd contains the probiotic elements. So
yes,
the curd also helps in the gut health. So curd with the isabgol helps in the IBS conditions. But for normal
yes.
constipation, for the habitual constipation, taking
Mhm.
at the night is the most recommended way.
Okay. And should it be, what is the role of chia seeds as far as these are concerned? They are also supposed to be helpful as far as constipation is concerned. What do you think about that?
So, yeah, chia seeds are helpful, but chia seeds come as they are much lower in the rank of whether the
Okay.
isabgol or haritaki or
Right.
senna, etc. It's a very on the lower role. So we have a in Ayurveda we have a protocol trifla churna.
Yes, yes, yes.
Trifla churna is the almost most of the early patients uses the drug of choice. Take it in the night, 1 spoon.
Mhm.
Take in the night, and the morning complete the one boil of it will be there because it contains amla also, vitamin C as you
Okay.
mentioned,
Okay.
amla also, haritiki also, vibhitiki.
Yes.
Vibhitiki is Terminalia bellerica, which is a very good anti-worm. So if the constipation is happening because of any worm infestation, worm infection, so vibhitiki will take care. Haritiki, as mentioned, it
Okay.
propels the intestinal movements, and amla is the vitamin C. It's the ideal combination of the proper gut health. Yeah,
Mhm. And what is the dose of what you just mentioned just now? Trifla? Dose of trifla?
5 grams, 1 teaspoon, 5 grams.
Okay, okay, okay. Right.
Yeah.
Thank you. Thank you very
Thank
much.
you, sir.
Thank you.
So, to update you, sir, Trifla Churna, because of Amla and because of Haritaki, it will be slightly bitter in taste. So,
Mhm.
some people might be finding it difficult to take that bitterness. So, if the people have any difficulty in taking Trifla Churna, so Dabur has Trifla tablet also, 500
Mhm.
250 milligram tablet. So, 2 tablets at night will have the same effect as Trifla Churna. So, tablets will
Okay.
be easy to take.
That is
But
really good.
as a doctor, my first preference is Tripla Churna because that will
Mhm.
have a higher absorption and higher efficacy as compared to
Mhm.
tablets.
Right. Thank you. Thank you very
Thanks.
much.
Thanks.
Many thanks, Dr. TP, for the detailed discussion and throwing the Ayurveda perspective. Especially, I like the Sanskrit shlokas, which kind of simplifies the entire gamut of the problem that we have in few words. So that was quite knowledgeable, and I think we must practice the Sanskrit shloka that sir you said. Although I know it's very very difficult in today's world. We are open for questions now. And before that, may I share the screen and share some of the products that we have at Dabur, so that yeah, if my screen is visible, sir.
No, not yet.
Not yet.
Now, now sir.
Yeah, it's coming in.
Yeah,
It's
yeah.
fine now.
So at Dabur, we have a very holistic range of solutions to give patient relief and a holistic relief rather in a problem like constipation. Dr. DP very rightly mentioned cubs over, which is a senna based product, and we have seen with the clinical data also that senna based laxatives are much senna based. Senna is actually a purgative, so
Anuj,
senna is
Anuj,
much, much
Anuj,
better.
Anuj, suggest
Sir,
you to open the slideshow.
slide. Okay, is it not coming, sir?
No, it's a sorry, full slide, full slide. Yeah,
Now, sir, in mine it is full slide, sir.
it's not coming here.
It's not coming, sir.
No.
Uh,
एक just a second, sir. Uh,
अनुज सर स्लाइड स्लो शो कीजिए आप अपनी पीपीटी का ना
हाँ मैं शेयर में ही जा रहा हूँ, शेयर में, शेयर स्क्रीन या स्लाइड्स योर
अपनी
कंप्यूटर.
पीपीटी का स्लाइड शो कीजिए आप
Okay, just a second. Yes, sir. Now is it visible, sir?
yeah.
Yeah.
Yeah, yeah. So, as Dr. DP rightly mentioned, that we have a holistic range of solutions for a problem like constipation at Dabur. We have Cubs Over, which is a Senna-based product, and in clinical trials also we have seen that Senna-based solutions are much effective as compared to lactulose. So we have Cubs Over, which is enriched with Senna, and which provides a very faster relief in the constipation because Senna, we all know, is a very potent purgative. We have Dabur Nature Care also with double action in constipation and gas, and we have Nature Care with the enriched formulation of Isabgol. Apart from this, if we look at this nature care, sir was asking whether we can take it isabgol regularly, and it is non-habit forming. Yes, it is non-habit forming. It is at Dabur's isabgol nature care is much more premium isabgol that we use because in the markets there are what generic versions or slightly inferior qualities available, but we use a premium one which is healthier and very easy to swallow. And as Dr. DP mentioned, that if we store it for little more time, more than 1 to 2 minutes, it will for a lump, and it becomes very difficult, for a patient to kind of swallow it down. So it is fine one, very easy to swallow, and the patient also gets instant relief. The other aspect that Dr. DP also mentioned about nature care being very safe and effective in apart from pregnancy was in the patients suffering from the cardiac problems, heart problems, and the reason for that, as we have already known, is that nature care, what it does, it forms a layer on the wall of the intestine, because of which what happens, the absorption of cholesterol is hampered, and because of which the cholesterol absorption is hampered, and the control of cholesterol happens. So the cardiac patient, which has a lot of issues, if he takes nature care, right, the long term use is also safe, and the patient gets relief from constipation on a daily basis. Very effective solution. Cubs over, it is in the form of granules, sir, which is also having all the constituents of Ayurveda, castor oil, ajwain, shunti, lavan kala, we have senna, hartiki, and soft. So this is in the form of granules and effective relief from constipation. And apart from this, sir, we also have a brand called the Trifgol. Trifgol is basically it can be also used with problems apart from constipation like IBS, and it is laxative with Triphala and Isabgol. So it's a mixture of Triphala and Isabgol, which is a very unique formulation, provides faster relief. And the beauty of this is, sir, it does not have any added sugar, a very natural and a very potent solution. Apart from this, we have Aviarista, which is king of medicine, a fermented liquid, and very useful apart from constipation in piles, dysuria, flatulence, anuria, gas, and others, and all. And in Ayurveda text, it is mentioned as one of the very useful medicine for myriad of conditions, including hemorrhoids, abdominal distension, constipation, difficulty in urination, and painful urination. Also, we have, sir, another product called as the Dabur Tirfala Churna, which sir also mentioned already. We have tablets also. So churna, we all know it's a combination of three herbs: amla, baheda, and harad, and very potent, effective laxative with colon cleansing properties. Typically for detoxification, the accumulation of ama, as we call in Ayurveda, it kind of helps to relieve that. The beauty of the Dabur Trifla Churna, sir, is that apart from which are there in the market, is that we use very, very premium quality product under very, very stringent manufacturing quality controls, so that we ensure that the patient gets the best quality product from the Dabur, sir. So we have this small range of brands, sir, to take care of constipation. And Dr. DP already mentioned that apart from that, we have Am Pachna, what is Kada, sir, right? That sir has mentioned. So with this, we are open for the questions. And sir, one of the question, Dr. Kohli, is that how do we tackle the upcoming problem that you mentioned, apart from the physical constipation, the emotional constipation, right? Because somewhere the emotions, the stress, and today's a very taxing work culture, both at the office, at home, right? There are umpteen issues, right? How do we handle that? Is there a medicine, first of all, for that?
No, I don't think I will recommend any medicine for that as such. Though, of course, ashwagandha is very effective for managing your day-to-day stresses and all that, and effective for many other conditions also. For example, hypothyroidism as well. I'm using it routinely. But for the other aspects of it, what is important is that all of these emotions arise from a particular level of our astral body. What we need to do is we have to rise above that. And to do that, you have to fall back on yoga, pranayama, and meditation. Now, there's some very specific pranayams which are very good for alleviating your stress problems. I think the most important are two. One is diaphragmatic breathing. So when you do diaphragmatic breathing, which we in our terms called gehre lambe saans. Now, as you know that in yoga, we lay stress on exhalation. So in this particular pranayam, you are prolonging your exhalation while breathing, while your inspiration is just a normal inspiration. So when you prolong the expiration and apply mool band after that, if there is no contraindication to a mool band, then what happens is it affects the diaphragm. When the diaphragm is affected, automatically your parasympathetic system comes into being, starts acting. When the parasympathetic system starts acting, your breathing starts reducing, your heartbeat starts reducing. And the moment this happens, the mind starts slowing down. So this alleviates your stress problem. So the more you do it, the better it is. That is one. Another very important one is Brahmani Pranayama. Brahmani is very effective for many reasons. One of these is this, because what happens in Brahmani Pranayama is that when you are producing that humming sound, then this humming sound, the vibration it produces, it gradually and very subtly synchronizes the vibration of your cells with this sound. So what happens is that you start vibrating with nature's symphony. When that happens, you're imbibing all the good qualities of nature. And of course, lastly, meditation. As far as medicines are concerned, I don't rely too much on them because you got to change your lifestyle. Apart from that, of course, if you change your food habits, if you eat healthy, you exercise properly, you sleep well, automatically most of your things are going to settle down. Then there's certain other things you can do. For example, Qigong is basically tapping and all that, which is very easy to learn. And yet another important thing is vagal stimulation, which you can do through face yoga. Face yoga is nothing but contorting your face, opening your eyes, closing your eyes. You basically stimulate the Agya chakra by opening and closing your eyes like this a number of times. That helps. Or you fill up air in your mouth and keep swishing it in your mouth in different directions. That automatically stimulates the vagus nerve. Or you tap your face at different points. You can tap here, you can tap here, you can tap here, tap here, tap here. So all these sort of tapping things, they all stimulate the vagus nerve. So these are very, very effective methods. In fact, I do them personally every day, and in my yoga class also I'm teaching them every day, and it leads to excellent results. The only thing is that people don't take these things seriously. They think, well, yogi karta hai, all that sort of thing, but they're very effective. One should try them to understand actually. So medicine, no, I'll not recommend any medicine for that, but these things help a lot.
Dr. TP, sir, we have a product called as Stresscom. So, do you think, sir, Stresscom as a product, because constipation, many of the times, the medical science also today believes that stress is one of the leading cause of constipation and GI issues, typically IBS, sir. So, do you think, sir, Stresscom as a product can be very useful and beneficial in constipation, which is induced primarily by stress and other, psychological factors?
See here again two angles coming from Ayurveda and coming from the scientific studies. I don't think ashwagandha as such has any role in the constipation prima facie, because ashwagandha, as Dr. Sab said, it's a very good anti-stress agent. As you mentioned in the emotional stress, what happens in the emotional stress? Why people get emotional stress? Various because of various conditions, psychological hurt, the emotional stress improves. So the cortisol levels improves significantly at that time. So when the cortisol level improves, immediately the concentration disturbs, patient get anger, and the stress levels improves. Here, ashwagandha is a drug of choice. We have a stresscom in the liquid form, in the oil form, which crosses the blood-brain barrier, which actually acts at the central level, brain level, which immediately reduces the cortisol level. So, people who are having a stress-related issue, maybe with constipation, may not be constipation, stress-related any issue, stress-related diabetes also there, stress-related thyroid is also there. So, stress can impact many other problems, not only constipation. So if a person is having stress-related any issue, so they can take stresscom, which affects within 15 to 20 minutes. That is proven. Cortisol reduces immediately, and people are out of stress, so they can do the normal routine. So that's one part. So that's how we can address that stress-related issues. Now coming to constipation, if I take Ayurveda literature, अश्वगंधा अच्छा constipation क्या होता है is the stool movement, bowel movement is obstructed or irregular. That's called constipation. And in that movement, in Ayurveda, all these movements are governed by Vata, right? So Pitta controls all the digestion, and Kapha provides the lubrication, and Vata provides the movement. So the movement is obstructed here, right? Ashwagandha in Ayurveda is Vata and Kapha Hara. So it is Vata Hara. So Vata को pacify करता है. So by relieving the Vata, it can facilitate the intestinal movements. That it can do. But please remember, it has no role in the Pitta and Kapha Hara. Kapha को कम करता है. So lubrication को कम करने का chance इसमें है. So it's not directly related to the constipation. So that's other angle if we come from the Ayurveda. So that's the answer to this. So if it is stress related, definitely helps, but not as per the constipation alone.
Sir, one
Thank you.
question is there from doctor who says, Trifla, do we have in the liquid form available from Dabur? So, would you like to answer that, sir?
Yeah, we have Trifla juice available. We have
Trifla juice. Okay.
we are marketing Trifla juice.
Okay, okay. And what is the shelf life of Isabgol that we have, sir? There's a question from Dr. Deepak Anand, I think. He's
So
asking about.
we have in Dabur we have Dabur Isabgol available, plain Isabgol, and Dabur Nature Care, which is the Isabgol mixed with a few herbs, Nature Care double action, Nature Care Cubs over, and Thrift Gold. So five products are available in Dabur with Isab Gold combination. So Dabur plain Isab Gold, which is like Sat Isab Gold of telephone brand, is having a shelf life of 1 year only, because it is plain Isab Gold, nothing value addition. We just procure from the Isab Gold, polish it and pack it in the container. So that's having a shelf life 1 year. Rest all the brands, Nature Care Double Action, Cubs Over, and Thrift Gold, all these have a 2 year of shelf lives.
Thank you, sir. Thank you, sir. So, Dr. Kohli, any suggestions to the typical chronic constipation patients apart from that you mentioned, sir? Diet, medicine, meditation. exercise, pranayam, because many of the times the questions are like that: we do not have enough time to practice all this. We are busy with schedule. So it's not that people do not know. Everybody knows that we should have lukewarm water, we should exercise, we should do yoga, we should do pranayam, right? So there's no dearth of knowledge. So what's your
In this, we should not forget that chronic constipation can be at some stage leading to other complications. And as I mentioned earlier, these other complications can be diverticulosis. So you need to check for diverticulosis. That means you then have to resort to allopathic investigations, maybe a endoscopy, colonoscopy, or whatever, or capsule endoscopy, to find out, because a person may be just having chronic constipation, sometimes alternating with diarrhea, suggesting an irritable bowel sort of a picture. But in reality, it may be because of either polyps or maybe something else in the colon. So that will not resolve with any of these things. Then you got to find out whether they are playing a role in that or not. That is one. Second is, if you suspect small intestinal bacterial overgrowth, unless and until you treat that, constipation is not going to go away. That has to be looked into. Similarly, either bacterial overgrowth or fungal overgrowth, and often they go hand in hand. And you suspect that if there's a lot of bloating, if a person has other lesions in the body also, like itching, skin complications, eczema, dermatitis, joint problems. So anyone who has, let's say, chronic constipation along with other associated symptoms or signs in any other system, then you suspect a leaky gut. So that leaky gut has got to be addressed. That means firstly you got to detoxify the body completely. And Ayurveda has excellent methods of detoxification. You detoxify those. If there's a polyp or something like that in the gut, you need to decide what to do for that. Polyps may not require any surgical intervention, but if there's something else that might require some surgical intervention as well, or it may be a part and parcel of malignancy in the colon. So that would also need to be looked into. So my suggestion would be, initially you treat by the methods which we have discussed, but if it doesn't go away, then you have to suspect other complications and treat them. Very often, patients come to you with anemia. They have chronic constipation and the hemoglobin is very low. You can't figure out what is happening. Sometimes you think that is maybe it is B12 deficiency which is causing that. And a very simple test of checking for piles will give you the answer. They may be bleeding from the piles, and the piles being a complication of this chronic constipation. So of course you correct the piles part of it, but that will get corrected only if you correct constipation. And for that, there may be something else which is causing the constipation. So that has to be looked into. Similarly, I mentioned about the thyroid part. Hypothyroidism is goes undetected and untreated, and the constipation is never going to go away. They will improve for a little while with whatever we give them, lifestyle or whatever we give, but it will not get cured unless you start correcting that also. I think that is what I would like to suggest, that we should not forget the other complications which can take place because of constipation. Look into those and try to correct them.
Thank you, sir. Sir, last word from Dr. DP, sir. What would be your message for people who suffer from constipation, especially the younger generation like me who goes to office, has a lot of work, and who cannot take care of their health, sir?
So it's not a message, as police are mentioned. It should not be ignored at any cost. If a
Correct.
constipation is becoming chronic, if it is becoming habitual, it should not be ignored. It should be taken. It should be addressed immediately. It could be diverticulosis, or it could be intestinal obstruction because of various other problems. And because I have seen many people, many youngsters. In fact, I'm saying youngsters. I've seen many youngsters below 50 years of age having chronic constipation unattended, and finally landing at the hospital getting for the surgical intervention of the intestinal procedures. So this is the very severe case, because it cannot be ignored at any cost, because as I mentioned in the earlier, everyone knows constipation is the root cause of for many other diseases. So it is not simple constipation. Constipation may be a daily problem, but it can cause several other health problems if it is not attended properly. So we have discussed several daily routines. If one's lifestyle is addressed properly, automatically the gut problems will be taken care. So most of the gut problems happens because of the lifestyle only. As Kulsar mentioned, early to bed, early to rise. Take enough water, take enough vegetables, take enough fruits, fiber food, which are good for the gut health. So these are the simple measures, along with what are the recipes which we have discussed. That Bhojanagre Sadapathyam Lavanataka Bhakshanam, Agnisandeepanam, Ruchyam, Jiva like problem. And Takram, buttermilk is one of the best thing, taking charge every day. If you see, I'll just give you one example. Most of the doctors might be aware who are listening to me. Most of them might be aware. In Western Rajasthan and Gujarat, where besan is one of the key element in their food habits. Both food besan ज़्यादा खाते हैं वहाँ पे. In Gujarat also, in Western Rajasthan, or upwards from Mount Abu, Udaipur side. If you see there, literally every meal they will have a charge. A glass of charge वहाँ पे मिलता है आपको. This is the reason, because besan causes intestinal problems. Excessive consumption of besan causes intestinal problems. So people there, they know about this. Knowing this, they every time, whenever, मतलब मैं तो कभी मार्केट में जाता हूँ, टूर पे जाता हूँ, but whenever I go anywhere across this Rajasthan or Gujarat markets, charge is one common factor available everywhere. So that is one of the very good diet habits we should also follow everywhere, because charge is very good. It's very light. As I mentioned, बार बार charge बोल रहा हूँ, it's not lassi. People understand, misunderstand lassi, not the lassi, not the butter. Butter निकालना है, charge करना है. The charge is very light in digestion, quickly gets digestion, and it also improves the absorption of the food what we are taking. So that's one thing we must practice every day. And one common thing is, आपने बताया था youngsters के लिए, because of the youngsters जो है, most of them are into the software companies or IT, और sitting ज़्यादा होता है, that stationary position में काम करना ज़्यादा होता है. तो देर इज मैनी एक्सक्यूजेस दैट, अरे हमारा स्टेशनरी पोजिशन है, हम एक्सरसाइज नहीं जा पाते, लेट नाइट आते घर पे, कैब नहीं आता, बल्कुला. Even if that is the condition, if they start taking lukewarm water, replacing the normal water with the lukewarm water, the gut becomes clean and healthy. भाई आपको घर पे काम करना हो, या वर्क फ्रॉम होम कर रहे हो, या घर ऑफिस में बैठ के ही काम करना है, आपको टाइम नहीं मिल रहा कहीं पे जाने का, एक्सरसाइज करने का, 5,000 स्टेप्स करने का भी टाइम नहीं है आपके पास. आप हो सके तो ऑफिस में थोड़ा वॉक करो. ऑफिस में भी वॉक नहीं कर पा रहे हो, कम से कम जो नॉर्मल पानी पीते हो या कोल्ड ड्रिंक पीते हो, उसको रिप्लेस करो गुनगुने पानी से. lukewarm water is one of the best medicines for gut health. Taking lukewarm water at bedtime and in the early morning is ideal. It's like amrut for the gut. So that's my simple suggestion for all the doctors or all the youngsters who are listening to me. Thank you, Anush.
Thank you,
There's
sir.
a few things I wanted to just mention, if you can give me a couple of minutes.
Please, sir. Please.
One, as what Dr. Durga Prasad is saying, I'm doing most of what he's saying. So I'm very happy about that, that it's been sort of corroborated. I have lukewarm water, get up in the morning, add some lime to it, and have about 2-3 glasses of that every day. Now, apart from that, I have charge every day after lunch. So it's been corroborated. I'm very happy about it and thankful also for that. Now,
Thanks,
there are a
sir.
couple
Thank
of
you.
points I wanted to just mention, and one of them is that constipation is also very often a part of celiac disease. And celiac disease is what we keep talking about it, but we really don't take it seriously because we think that we don't have it. It's quite common. Celiac disease, and so also wheat allergy or wheat sensitivity. We should explore that in earnest. Apart from that, I would just like to say that as doctors, now we were always taught in medical school that we should examine the patient thoroughly, from top to bottom. But very few of us are actually doing that. And in my experience, I've realized that if I examine the patient's eyes, I examine his nails, I examine his palm, I examine the entire system as much as I can, I'm picking lots of things which are guiding us into the diagnosis, which we are missing out. Most doctors are missing out on that. You examine the tongue. You know, Ayurveda and naturopathy talk of tongue diagnosis. Chinese medicine talks of tongue diagnosis, but we are not doing that. We pick up so many things. You pick up a black tongue, that gives you an idea about fungal overgrowth somewhere. It may give you an idea about C4, that is intestinal fungal overgrowth. So many things like that. So just a word of, just a suggestion that all doctors should not forget to examine a patient from top to bottom. You should spend a few minutes more and examine, you'll pick up a lots of things. That's all I wanted to say.
Great, sir. Thank you so much
So,
for your time. And
Anuj, before closing, one final remark. Sorry, sir. One final remark. Usually there is a misnomer that 1 घंटा walk करना है, 40 minutes walk करना है, या जितना भी walk करना है. So latest trends, some studies have found out that it's not 1 hour continuous walking not required, 40 minutes continuous walking not required. तो आप बोलो ना anxious क्या करना है, 40 minutes walking not required, 1 hour walking not required. The requirement is after every meal 15 minutes walk. ब्रेकफास्ट के बाद 15 मिनट वॉक करो, लंच के बाद 15 मिनट वॉक करो, डिनर के बाद 15 मिनट वॉक करो. दैट इज द राइट टाइम टू वॉक. बिकॉज जब भी आप खाने के बाद आपको टाइम चाहिए, यूजुअली वो नहीं होता मुझसे, बट दैट इज द राइट टाइम. सो इट हैपेंस 40 minutes only at the end of the day, but after every meal. So that's the ideal way to take care of the weight also and the digestion also. Thank you.
Yeah, and
Great,
also
sir.
if you've been sitting for a long time, if you sit for an hour or so, you must get up for a couple of minutes, walk around, and then sit again. If you sit prolonged for 3 or 4 hours, that is going to be very harmful to you.
Great,
Thank you,
great.
Dr. Chitraka. That was a good
So
point.
I think what Dr. DP said, that post lunch, post dinner, and post a meal you should walk. So let me put this practice today itself. After lunch, I think I should go for a 15 minutes walk and then see how it works. But nonetheless, sir, thank you so much for the valuable session and insights. Dr. Kohli, thank you so much for your time. It's always a pleasure to listen to you, bringing in the various
Right.
aspects of Ayurveda, allopathy, and your international and domestic experience of so many years, right? So it's always a pleasure listening to you, and I'm very sure the feedback that we get from the doctors, right? They always say that it's always so insightful and so simplistic, rather the way you frame
Right.
it up. Well, although it's very complicated, right? In treating a patient and then looking at it, but the way you put across things, it's very very simple. Even to a person like me, I can understand many of the things that you say. Thank you so much for your time, sir.
Thank
And
you.
from the entire family of Dabur, we wish everybody stay healthy, stay safe, and practice the holistic way of living. Thank you so much. We'll meet next time, next month. Until then, from all of us, from the Dabur family, thank you so much. Take care, stay healthy, stay safe. Namaskar.
Thank you. Thank you very much.